This team had, there was an error. We had a 60-year-old female patient that was getting an implantable defibrillator and received the wrong device. There are several different types. And so the error was identified post-op. She was in recovery and said, oh, I thought I'd feel differently. And the nurse said, well, let me just check. And when she went to check her file and she read the chart, she said, I think you got the wrong device. Called the team in, did the review, disclosed, and the patient went back in and had the right device implanted in a flap below the skin and went home that day. So aside from a slightly higher chance of infection and some inconvenience, a few hours, she was okay, fortunately. That team was not okay. That team was devastated. They are a high-performing team. They pride themselves on how much they do, what a difference they make in their patient's life. It was devastating. So we identified, we went through the process again with them. You know, and this is hard because you got to say to people, slow down, because they're putting fixes in place, right? Right after this, we got a fix, we're done. We said, well, slow down, let's be systematic about this. So we did go through the process. We identified 4 causal factors, 4 safeguards that we had that either didn't work or weren't followed. And we went through and we analyzed those for root causes. We came up with a bunch of recommendations, which in essence is adding safeguards to our process. More opportunities to trap the error or prevent it from hitting the patient. And so in the end, it was a big success. They improved their process and the reliability of their system. And that's what we wanted. But we also helped them through this by giving them that opportunity to be vulnerable and talk about the things that are hard to talk about, and being supportive and providing opportunities to support the staff. So again, review at the program level, review at our quality of care committee, and this was one of the first teams we invited to our artichoke rounds to talk about the errors. And artichoke rounds take place on Tuesdays, and I had been asking this team for a month. I think you guys could come and just talk, not a lot about the details, but you know, how you were feeling and how the review helped us get to a new place. I'm not sure. I think that's punishing. I don't really want to do that. I don't want to embarrass myself. And in the 11th hour, somebody said, okay, I'll do it. So it was supposed to be the manager and the physician and the nurse that would come and talk about the case. In the end, when they came, the whole team said, I'm not letting her stand up there by herself. They all got up and stood beside the nurse and the physician and the manager. And they told their story, and it was very powerful. And everybody in our forum, there was about 35 people, dead silence. And in the end, the team had to leave fairly quickly to get back to clinic. But it was very, very powerful. And people in our audience said, I feel like I need to reach out to them. I think I need to support them. I want to do something. So we said, okay, send emails to me. I'll forward them. I'll gather them up and forward them to the team so they can see that support. And they were blown away that people took the time to say, thank you for sharing. Thank you for being open. I would trust my mother to come to your team. Those kind of comments. Very, very powerful, a huge, palpable shift. And so this was written by the manager. He said their story was powerful, was a powerful reminder of balancing trust with safety checks, and that even higher performing teams can learn and improve from mistakes. Oh, sorry, this was a feedback from somebody else. It was evident that these professionals truly care about our patients and each other. Thank you to each of them for stepping up and speaking up today. We all, including our patients, benefit from these dialogues. And that was one of our values in our previous strat plan, was speak up. And I know that's a big focus with the Joint Commission. And in our new set of values, it's every voice matters, but the same message. So it was a very powerful way to take those lessons. And a year later, that team was stronger than ever, much more connected than ever, and their processes were much more reliable. So it was, one of these very difficult experiences, and through vulnerability and a systematic process, really gave them a foothold to bigger and better. And they have struggled since, but they have such a strong network and connection that we'll often go in and support them in debriefs to move that forward. And now when we have a debrief, all the physicians are clamoring to get in there too. They've typically done their own thing and been excluded or just touch base with them, but they want to be there too. The respiratory therapists want to be there. All of the supporting staff. So it's really kind of interesting how this has evolved. And then of course we have the Institute for Health Improvement has what they call the triple aim. Their focus for improving healthcare on focusing on population health, experience of care, and per capita cost. And in the last few years, there's been discussion about we really need to make it a quadruple aim, to add the experience of the care provider in there as a focus. And so that, along with what I know to be true and what our organization believes in terms of people and caring for people, have really become the foundation for how we try and create a cultural shift in our organization. That in support of, in Canada, we have the Canadian Standards Association, the CSA standard, for psychologically safe and healthy workplaces. This really creates a great foundation for how do we make workplaces better, healthier, safer. This is a free download. So if you go to the CSA website, you can download a psychologically safe and health and safety in the workplace, the guideline, and there's an implementation plan that allows you to audit and evaluate your current systems to see where you want to focus on improving. But it has kind of 13 workplace factors to work on. And so we're not going to work on all of them at once, but we'll prioritize all of those things. So you can see things like psychological and social support, leadership expectations, civility and respect, engagement, balance, protection of physical safety. So it covers quite the gamut. The other thing I want to point out, and we hear it a lot in the news right now in Canada, and I'm sure you hear it in the US, the operational stress injuries. So our Canadian Mental Health Association calls operational stress injuries any persistent psychological difficulty resulting from operational duties, and they give a few, or other service-related duties. That individuals experiencing high level of operational stress injury are at greater risk to suffer from depression, anxiety, or PTSD, post-traumatic stress disorder. In fact, they started calling it post-traumatic growth disorder, but So these are the first responders that you hear about, the police and fire and EMS and doctors and healthcare workers that struggle through trauma. And our Ministry of Labor in Ontario has a First Responders Act that they're now compensating workplace injuries as operational stress injuries as a workplace injury. It's not as clear cut as some of the others. So if there's a single traumatic event, it's much easier to make that claim versus over time, that persistent stress. And in a recent peer support course I took, the fellow that was leading it was a staff sergeant for our York Regional Police. And he called it, it's either the Mack truck or the 1,000 paper cuts, right? The 1,000 paper cuts. Those are harder. But think about what these workers go through every day, EMS, police, fire. So in recognizing that there are those kinds of injuries, we need to be cognizant of that and find ways to mitigate those. The other piece of this, which really takes us back to Mike Williams, is the sanctuary trauma. And that's when an individual who's already suffered from a stressor and goes back to what's expected to be a supportive environment, finds out that there's just one more trauma because they're let down by their organization. They're called lazy, a malingerer, or difficult. And we neglect to take care of our staff after those incidents. So what really this does is creates that loss of connection. And how many people here heard Mike Williams last year? Yeah, so he talked about that after the incident. And he came out of the waters and up on the banks, and they whisked him off and sat him in front of 20 lawyers or 13 lawyers. And then they isolated him at home, and he couldn't go back to work, and there was very few supports there. And so these are things that are kind of a bigger picture with our staff. And we have people that go off on disability after incidents. They can't get themselves back to work. They're suffering from trauma, and then they feel very isolated. So how do we do better? How do we care for our staff after incidents? And I think the first thing is acknowledging the problem.